Hi, this is Scott Pop for Mobility Minute. We're going to talk about shoulder function. When people think of shoulder function, they obviously think of this outer joint here. But in reality, the most important aspect of shoulder function, in my opinion, is the scapula as it moves on the rib cage. Without the scapula moving properly, the glenohumeral joint is going to be compromised, and usually the injuries out to the glenohumeral joint and the rotator cuff are secondary to the scapula not moving on the rib cage. Let's take a look at all the areas of tightness and dysfunction that can limit the scapula from moving properly. We've got the upper trapezius muscle here. We've got the levator scapula muscle here. We have the cervical system that attaches all the upper fascia. We have the rhomboid that comes down in through this area, which is responsible for retracting the scapula. We have the latissimus muscle that attaches underneath the scapula and to the humeral system here. We have the serratus anterior that comes around to this side. We have the lower trapezius that comes down in through here. And then we have the pectoral system in the front. And we have some of the subclavicular system here. So we're going to break these down in terms of specific mobilizations that I do with the patient and things that you can do to help release the scapula and stop the impingement and dysfunction in the glenohumeral joint. The first system we're going to stretch is the upper trapezius and levator scapula system. How I do this is just having the patient sit. I get my elbow right in the crotch of the neck and the shoulder, and we tip the head away like this, and then oftentimes I turn it towards it and tip away like this. I work out, and almost everybody has overactivity of the upper trapezius system. Tip away and down towards it like this. What we can do is use my neck flosser for having the patient treat this area. Take your hand right here, right in the middle there, good. Take this hand right here. This is a tool that I've invented, and you basically push down and tip your head down and away like this, and then turn it towards it and tip away. And you can work out along the upper trapezius area and stretch this. This will help the scapula abduct by lengthening the upper trapezius muscle. Next, we're going to talk about mobilizing the cervical spine and how I do it. I'm going to show you how I do it and how you can do it. So the first thing we're going to do, or I'm going to do, is I'm going to hold one vertebra and I'm going to turn his neck in the opposite direction. And I'm going to stretch the attachment and mobilize these joints, working each segment up the cervical spine. Almost everybody will have some tightness up and through here. Feels really good to mobilize it. Start at the lower level, work up, or start at the top and work down. To mobilize it on your own, you're going to use my neck bridge. You're going to lay on the neck bridge, start at the base of your skull, turn your head sideways, and just work the cervical joints. Work all the way down the cervical spine with the neck bridge. I've used this bridge for a long time. It's great for self-treatment of cervical dysfunction, and it will complement working this upper trap system at the attachment of the muscles in the cervical spine. There's a couple ways to work the neck system, which is the rhomboid. The rhomboid goes from the spine out to the scapula. It helps retract the scapula. If it's tight, the scapula can't abduct, and this is one of the major areas of dysfunction. So what I do is I find the medial border of the scapula, and I have him turn his head down and away. And we're going to work right down that medial border. You can use a tool if you want. I'm just using my thumb right here. And you just slide right on down that medial border of the scapula. This is one way to do it until you go all the way down. Now I'm going to show you the second way to do it. This is the second way we can mobilize the rhomboid, and it's very, very effective at stretching the scapula away from the rib cage. Notice the patient is laying in this counter-rotated position. I have his leg back on one side, his shoulder back on the same side. It's like the gate position, and so he's kind of spiraled through here. So what I do is I really get into this muscle right here, and you can see the belly of the muscle at the medial border of the scapula, and you just really get in there and you stretch, and you stretch into this area. This is probably the most effective stretch for shoulder problems that I've ever come across. It really helps pull that scapula back, get it off the rib cage, release the tension to this rhomboid system. Just a wonderful, wonderful stretch. Then the self-treatment for the rhomboid is taking a lacrosse ball. Why don't you lay on your back for me? So what you're going to do with this lacrosse ball is we're going to have the patient roll to one side. We put the lacrosse ball right on that medial border of the scapula and have him roll back on that lacrosse ball. That creates a really good stretch to that rhomboid. Works up and down here, just like that. Good. Up and down, just like that. Good. So you can work along the spine, along the rhomboid. Lacrosse balls work the best. Tennis balls do not work, they're too soft. Smaller balls won't get in deep enough. You don't need to put all the pressure on it, just enough to be able to really stretch it. Some people can tolerate more, some people can tolerate less. But again, this is how you treat it yourself. And the side posture is if you're going to treat somebody else's rhomboid, that allows it to stretch off that rib cage. Okay, now I'm going to show you how to stretch the pectoral system. I like to get that body in that counter-rotated position, just like before. So what I do is I turn their head opposite the shoulder stretch here. So we're going to just basically push the leg down and the shoulder back like this. And you're really going to get in there and stretch that system. And you can work through the pec, out near the shoulder, push up and back. You can grab a hold of the abdominal system here and pull back like this. And oftentimes work the articulation of the ribs and the sternum in this area. You can get up underneath the clavicle, which is often very, very sore, like this. And then also you can stretch the cervical spine away from the shoulder. Good. Now I'm going to show you how to use a lacrosse ball to stretch the pectoral system. What you want to do is find the corner of a wall, put the ball up in areas of the pec that you want to stretch, and just put that into the wall like this. Turn the head away and really stretch that shoulder back like this. That produces a nice stretch to the shoulder. And then you're going to move the position all around where the lacrosse ball can go into the sternal clavicular junction, underneath the clavicle, all around the pectoral system in the wall like this. The next muscle we're going to show is called the latissimus muscle. It comes up from the lower back, inserts underneath the scapula here and the humerus. And you can either take your finger, really get into that muscle as the body is in this counter-rotated position again, just like this. Really get into that muscle and stretch the arm back like this. You'll often find really tight areas in this muscle. The next thing you want to do is put the bar underneath the lat, stretch like this. This is a PVC pipe, it works really well to just get in there and stretch. And you can work down the rib cage. It's going to be mostly tight right posterior to the axilla, the armpit area. Another thing you can do is take the arm down and you can work the outer bands here. The outer band of the arm is equal to the IT band in the lower body. And taking a little piece of PVC pipe and rolling this out is very healthy. In this position again, we can pull the shoulder back and work on the cervical spine, which is what I do. So you're working on the latissimus, the outer humerus, and stretching the shoulder back in this position in relationship to the cervical spine. Again, this is the gate position. We always want to expand the body out into the gate position. And I'm going to show you one last thing, which is using a foam roller for the latissimus muscle. We're going to demonstrate how to use the foam roller for the latissimus muscle. Basically put it under the armpit, and your body can be in a neutral perpendicular position and roll up and down. Go ahead and roll up and down. Just like that. Yeah. Then you can get different angles. You can roll back and get part of the rotator cuff like this. You can roll forward and get into the pectoral system like this. And then you can put the arm underneath of you and get that outer band complex. Yeah, just like that. And roll this. Great tool for getting lots of different areas underneath the shoulder. That is the foam roller. You can buy those at Walmart or Target. Any place has those that has sporting goods. The last thing that I do in my office is we work all the spinal segments up and down the back, because the shoulder fans out and attaches from the sacrum all the way to the skull. So sit up nice and straight. So what I do is I hold near the spine, counter rotate like this, and we work up each segment. And many times the shoulder can be related to tightness along the iliac crest, all the way up the back. I don't expect you to do this. We just work right up the spine, all the way up to the cervical spine. You can use that lacrosse ball all the way through here by laying on any tender spot, just working it a little bit to mobilize it. It helps produce some incoming information to the nervous system. It stretches the tight tissue. This would be the last thing that I would do in terms of treating the whole body in relationship to the scapula and the glenohumeral joint. So again, just to recap, we talked about mobilizing the scapula on the rib cage as being the most important. We really didn't even talk about the glenohumeral joint out here, other than its secondary relationship to this more primary movable area. So I hope this helps. You can do these treatments on a family member. They're fairly safe. Don't go too deep. Initially start lighter than you think. If you've never done it before, just be careful. And then when you work with these tools, with the neck bridge or the neck flosser, always think less is more. Some people get sore if they spend too much time on a tool initially. I've had patients, think the neck bridge was the greatest thing, and they use it too long and they can get sore from it. So even the lacrosse ball, you don't need to over-treat it initially. So just make sure you start low, work up. I hope this helps you. This is Scott Pop for Mobility Minute. Thanks for watching.